Aloha! This CME activity is jointly provided by the Queen's Medical Center and UH-JAPSOM Department of Geriatric Medicine. At this time, for CME purposes, please enter the name and credentials of everyone viewing this geriatric echo. As a reminder, evaluations are required for CMEs. You can find evaluations by following the link in the chat or at any time on our website and email advertisement. We offer free continuing education for this series when you complete our evaluations. Certificates are sent out the Monday after our educational series. Your comments are very important to the planning committee and will be used to plan future programs. About ECHO. We want to remind everyone that this is an ECHO webinar, which means that this session serves as a forum for mutual teaching and learning from experts and from each of us on the front lines. As to the ECHO model goes, all teach, all learn. So it will take all of you to create this community of learning. A little bit about our format. After a short lecture from our experts, we will share expertise from the rest of the team and then open the time up for case discussions. We invite you to share any geriatric cases. It may even be on a topic not related to topic of today's lecture. We only ask that you keep it HIPAA compliant, case for discussion. That means please do not share patient's name, birthday, address, and so on. We learn best from our patients. They are the best teachers. Our interdisciplinary team is here as well, and we are all willing to teach and share our collective wisdom with you. Most of you already know me. I am Juanette Gaylord, President, Alliance of Residential Care Administrators. We have Maribel Tan, President of Foster Family Homes Association, Elsa Talavera from All Island Case Management, Danielle DeLonghi from Aloha Care, Leila Vintar from United Healthcare, and Dr. Ritabel Fernandez from University of Hawaii. We just finished a 4-month series on what matters. If you are interested in viewing any of those lectures, you can find them on our website. We cannot offer certificates of attendance for videos you have viewed, unfortunately. You must participate in our educational discussing the importance of movement for health. Neufeldt is the owner of PT Works, LLC. Her company provides on-site physical therapy, occupational therapy, and speech therapy services to the assisted living facilities and care homes on Oahu. She has been a therapist for 27 years, with the last 17 years focused on geriatric care. Her advanced studies include fall prevention specialists and vestibular rehabilitation certification. Suzie is deeply honored to care for our kupuna. Their life stories inspire her everyday life. In her free time, she enjoys spending time with her husband and children, outrigger paddling, hiking, and traveling. Please welcome Suzie. Thank you so much for joining. Suzie, please take it away.
You are muted, Suzie. I think you need to unmute.
Can you hear me? Okay, all right. Hi, everybody. It's nice to see everyone. And we're going to be talking about the importance of exercise in the senior population. Hey, John, do we have the slideshow up? Nope.
You want to try to share your screen, Suzie?
Yeah.
Yeah, let me share that again. Okay. Can you guys see everything? Are we good? Okay. Sorry, I am not a tech savvy individual. So, well, let's go ahead and get started. So I want to talk to you, everybody, about senior exercise programs, maintaining and maximizing function. Well, once again, I'm trying to get to my next slide. Okay. So that's, I think, is, I love this slide. When I came across this this statement, I mean, it just was like, it was light bulbs that went off in my head. So exercise is the miracle cure. If exercise were a pill, it would be one of the most cost-effective drugs ever invented. Just think about that, okay? So we all know how important, exercise long. We have just neglected to take that recommended dosage. And we all know that the more medication that an elderly person on or is taking, the higher the risk of falls. This is why we need to make exercise part of the daily prescription, for our residents and for our patients. Because when residents are mobile, okay, and when they're healthy, they're also a lot happier, and they don't require as much care as well. So there's a lot of scientific data about the benefits of exercise. There's strong evidence that older adults, 60 years and older, who are physically active, they have lower rates of medical issues, they have a healthier body mass, enhanced bone health, higher level of functional health, and better cognitive function. Okay, so exercise and staying mobile becomes even more important as we age. I'm sure you guys have all heard the statement, if you don't move it, you lose it. Well, this is especially true in the elderly population. Just with hospitalization for 3 days, 2 to 3 days, the muscle mass and the deconditioning that happens in an elderly person compared to a younger person is significant. But even just immobility, in their daily lives, just sitting around watching TV all day, this is what happens. Muscle atrophy, deconditioning. Okay, then when you have that muscle atrophy, when you have that deconditioning, you're not going to want to get up. Okay, what's going to happen? They're going to be in more pain. Then what happens? Decrease that in functional ability, decrease in their transfer ability, decrease in their walking ability. And with that decreased function, okay, leads to that immobility, and that leads to an increased fall risk. So falling can have tremendous physical and psychological effects on seniors. Falling can lead to head injuries, fractures, and even death. So even if a senior recovers from a fall, they can be left with activity, decreased functional independence, and depression. Also increases. So once a senior has again. Okay, so let's discuss the recommended exercise dosage to keep our residents and patients active and healthy. So the CDC, the NIH, the AMA, they all their recommendations are older adults should do 150 minutes of moderate intensity aerobic activity throughout the week. Okay, and so we can break that up. I know that sounds like a lot, but that could be like 30 minutes a day, 5 days a week. So that's moderate aerobic activity. And included in that exercise prescription is muscle strengthening activities 2 or more days a week. So my job as a physical therapist is to develop realistic exercise and mobility programs that can be caregivers. And this is the general guidelines that we all should be following. And I know that some of you are probably thinking right now, like, well, this isn't realistic, but it can be. Aerobic activity can be as simple as a walking program. And so to establish a good walking program, you want to find out, or even program for that. Today, I was just thinking about a resident who I evaluated yesterday. He has COPD, he has congestive heart failure. He gets very anxious when he has that shortness of breath. Well, he does not want to be able to walk independent activity. The staff is like, okay, walk him go on. Walking, I've been to many, many, many care homes and assisted living homes, day health facilities, having like a walking group, after lunch, like exercise, you're getting exercise and muscle strengthening activity in. So cues, okay. So you also might be thinking, so those big steps, open up those feet, keep your walker in front of you and make it fun. Don't make it as just like a job or, just as a command, make it fun. Also say it loud. You got to project your voice in order for those, your seniors to hear you as well. So, with the walker, if you're finding that your resident, if their walker's getting way too far ahead of them, it's okay. Stop that walker, stop them and say, okay, let's stop that walker. And then just guide their low back up into a better standing position and then let them go on. Correct walker height. The rule of thumb is when a resident is standing, within their walker frame, the resident should have just about 10 degrees of flexion in their elbow. It shouldn't be way up here, because if they're standing and the walker's way up here, what they're going to do just through mechanics, they're going to push it way out in front of them. So those are just some good cues that we use for our seniors. This is what we also teach, at the care homes and at the assisted living homes. We teach this to the staff. So, walking programs are not the only kind of programs, that you can do. There's other, great group exercise programs that you can establish, are cost effective. With COVID, we saw the effects of social isolation on seniors. It's not good. So we really want to encourage, our residents to be together in a group exercise class. It's fun, and it is, there is that nice social component. I mean, me personally, I hate exercising by myself. I love exercising in a group. So this is a senior drumming program that I think is fabulous, and there's a lot of facilities on Oahu that are starting to adopt the senior exercise drumming program. Let's go ahead and watch this.
All right, here we go. It's 1, 2, 1, 2, 3. You get your heart rate up. You get hot. 1, 2, 1, 2, 3. You don't have to know how to drum. This has nothing to do with drumming skills. It has nothing to do with knowing how to, however Ringo Starr beats his drums. It has nothing to do with that. Nothing. 4. Reach. Things don't work like they did when we were in our 20s or 30s or 40s. 3, 2, reach. The only thing I can say is if you don't use it, you are going to lose the ability. Oh, don't we sound professional? Keep it center. 4, 3, 2, here we go. Pump. Keeping our upper body strong to push us up out of chairs, to help us lift things. I mean, you know, it's part of staying alive.
Fun. I mean, you're just laughing. You know, the music is really important. She picks out great music.
3, 2, again.
I would recommend it to anybody. I find it is much more strenuous than it looks.
2, and rest.
A lot of fun, for one thing. I have to have fun when I exercises or I don't do it. And that's the main thing for me, is having a good time.
It's down and up, down, up, down, up, down, up. All right?
Isn't that a great program? And so what I've seen at some of the facilities on Oahu, some of the activity aides are buying inexpensive round laundry baskets and putting the balls on. So there's all kinds of ways that you can incorporate like that drumming program or any kind of group activity program into your care homes or facilities. So again, let's review. So it's the CDC, NIH, AMA, their recommendations for exercise program is a moderate intensity aerobic program, 150 minutes a week, and that's broken down to about 30 minutes a day, 5 times a week. And again, you can do a walking program, you can do a drumming program, dance program, seated upper extremity program. So there's all kinds of activities that you can do. Then we've also, the other recommendation is strengthening. So it is recommended a strength program at least 2 times a week. So let's talk about some strengthening exercises. And a lot of times these are also very realistic, and you can incorporate this into a group program as well, along with aerobic conditioning. Strength exercises can include chair yoga, seated tai chi, lifting weights, working with like TheraBands, or doing exercises that you use with your own body weight. Here's some tips though. Okay, so I've been doing this for a long time, and here's just some of the things that I see, that I've seen good programs, I've seen not so good programs. So you want, for chair-based exercises, you really want to have a solid, stable chair, that doesn't have wheels on it. Video exercises, this is one of my biggest pet peeves. I do not like to see, seniors in a room by themselves with video exercises. No one's monitoring it. And a lot of times the exercises just aren't appropriate. There's a lot of times they're just too fast, or the volume's turned down low and you just see people sitting there. So you really should have staff present, to help motivate the residents, help them with their exercises. If your facility is choosing to do video exercises. Movements need to be slow and deliberate. You can build muscle mass, with your own body weight but it's got to be slow and deliberate movements. A lot of times I see people just rushing, rushing through the exercises, doing it super fast. Well, that's not going to do anything. So it really does need to be slow and deliberate. And then just remember, muscle strengthening exercises are not always aerobic activities. So you will need to do them in addition to the recommended 150 minutes of moderate intensity exercises. So I have a list of what I consider the classic exercises. But if I had to pick one exercise, and I always tell this to my patients, if there's one exercise that you are going to do, or you say, I will only do one exercise, it's the sit to stand. I can't stress like how important it is, because if a resident is unable to get from sit to stand easily on their own, functionally, they are going to decline. And so sit to stand, what I do, you can have the resident sitting in front with the walker. Don't have them pull on the walker, have them push, on both armrests, or one arm on the walker, one arm on the armrest, and it's just a sit to stand. So I do this 10 times, and you'll be surprised. A lot of people, they don't want to push too much, but you do need to push a little bit. Okay. You need to assess that resident. And if they can do it, let them do it. Okay. So 10 times up and down. And I do this too. I do this all the time with my residents, because I want to keep my quads and my glutes and my calves, everything strong. Now I did send the ECHO program copies of all these exercises. So I don't know how, you might be able to, hopefully you'll be able to, get copies of these exercises. Okay, balance. Balance is also a really important component, to maintaining mobility and fall prevention. It should be part of a residence program as well. You can do activities such as side step together, simple grapevines, heel toe walking, one-legged stance, step ups or step twos. And again, you can have someone holding onto a wall. They can hold onto a walker. And again, I have copies of all these exercises for you to reference after the presentation. And let's not forget about flexibility. Okay, stretching is so important for mobility, pain management, reducing joint and muscle stiffness. Flexibility also promotes like that upright posture and increased mobility of the trunk and the legs. And we need good flexibility also in order to do our sit to stand activity, in order also to reach for clothing, to bend down for our shoes. So don't forget flexibility. Some of the exercises that I really like to give out are neck stretches. So we can do, just side to side. This is our upper trap stretch. And you always want to hold your stretches for about 15 to 30 seconds. Okay, looking up as well. And we all need to do this, not just the elderly, we all need to do this. I mean, we're all spending our lives in front of a computer. So we got to stop during the day and just stretch. You want to stretch your trunk. One of the stretches that I love is extension stretches. Okay, going back like this. Again, we all spend most of our times in front of a computer, looking down. Our residents are constantly sitting. And so I get that resident up and I get them holding onto their walker and I try to get them back, just stretching just a little bit back, just to get that upright posture facilitated. We've got arm stretches. Okay, just by doing this feels good.
Someone had requested going back to the last screen. Can we go back to the last screen really
Sure. Okay,
that.
I mean,
Thank you.
this one? Or this one?
Let's see, Josie, do you have any questions about this screen? She said no. I'm not sure if it's this one. Maybe it's the next one. Is it the next one, Josie? Is it balance or? I think it's balance. The one with balance.
Okay.
Oh, you got it. Okay, she's got it. She's got it now. Thank you.
You got it? So all of these, every exercise that I have listed here, I do have a reference. I have pictures of all of these exercises for everyone. Okay. And lastly, just some additional recommendations. Aerobic activity should be performed in bouts of at least 10 minutes. I mean, I have a lot of patients, they can't do 30 minutes. You know, they can't, like, especially starting out, they just can't sustain 30 minutes. So, you know, breaking it up in bouts of 10-minute stretches is fine. Modify standing exercise. If a resident is unsafe, you know, standing on their own, again, you know, having that walker in front of them is fine. You know, having them, you know, be by a wall is also okay. So they can just kind of hold on, you know, if case they lose their balance. And again, it's best to be proactive, not reactive. Okay, so if you are finding that you have a resident that is declining, and the best way to know this is if look at their sit to stands. If they're sit to stand, if they were able to like sit to stand fine without assistance, without using their hands, and then all of a sudden you're noticing they're having a harder time standing up. They're using their hands, they're using their balance, or they're losing their balance backwards, or they're unsteady. Ask for physical therapy. Because that is a sign that they are getting a little bit weaker. So again, we would rather see residents who before they've fallen instead of seeing them after they fall. So thank you, everybody. I hope that I gave you some good information and some take-home points to go back to your care homes and assisted living homes. So that's it for today.
That's great. Do any of you have any questions you want to put in the chat?
Do you know about the guidelines or the requirements for the coverage of physical therapy, occupational therapy, and how that works throughout the year? Like, you're giving so many. I understand if you hit a plateau, then they won't help you anymore. But, you know, how often can you request physical therapy? How many days are you allowed throughout the year? Does it differentiate depending on your health plan?
Oh, great questions. Okay, so there's all different, you know, there is all different, you know, health plans. So you've got your straight Medicare plan, and under their Medicare Part B benefits, a resident's Medicare Part B benefits, there's about I believe it's a $2,220 cap for PT, for combined PT and speech services, and then a $2,200 cap for OT services. However, it really is up to the therapist to determine, you know, if a skill is needed for treatment. And I mean, a lot of times we can see a resident 2 to 3 times a week, at least, you know, for 2 to 3 months, you know, but, and then after that, then it's like, okay, well, is it really a skill? Have they plateaued? What we do in our facilities, we will you know, we will start out with a resident 2 times a week for 4 weeks, determine, if they need, continued therapy. We tend to then go to about 1 to 2 times a week for another month. And what we're doing is we're trying to work with the staff and the families to get them, at just at a good level where they can be on their own. But then we like to save some of the money. So we'll usually discharge them knowing in like a couple of months, they might decline and we'll pick them back up again. Now that's with like your straight Medicare plan. Now with Akamai Advantage, like the HMSA plans, we have to have to get authorization for the visits. Typically they give us about 8 to 12 visits per episode. Did that help?
Yes, thank you very much.
I would like to add a few things, Juanette, to your question. One of the greatly underutilized programs is home health. In Hawaii and in the United States, we are underutilizing home health. And we only think of it, oh, somebody had a stroke in the hospital and they go home with home health. Or they had a hip fracture and they go home with home health. But we don't think of it from the community. So if you have a resident in your care home, say the resident has a fall, you can get their PCP, you can request their doctor to order physical therapy. So I have ordered a lot of physical home PT for my patients in the community, not from the hospital, but from the community. Say I had a Parkinson's patient and the Parkinson's patient had a new fall. I can get home health. And one of the criteria for the therapy to come to the house is the patient needs to be homebound. Now, what is the definition of Medicare's homebound? Medicare is very generous. All that is said by Medicare is that it is hard to leave the home, okay? That's it, hard to leave the home. Patient can go to church on Sunday, it's still homebound. Patient can go for a haircut, still considered homebound. Patient can go for dialysis 3 times a week, still considered homebound. So remember, the definition is very generous. And if you have a patient who's had a fall, please consider getting physical therapy involved. And they can also do something called a home safety evaluation. They can evaluate your care home and give some good recommendations. So on bars, on lighting, on different ways of putting your furniture. So I love physical therapists. They're awesome.
Thank you.
That's great. There were some questions in the chat about the recommended exercises for low back pain or for scoliosis. Is there anything you could show everyone?
Oh, yeah. I can't see myself, so I hope, I can't see myself on the screen, so I hope you guys can see what I'm doing.
John, maybe we can stop share so everybody will see Suzie.
Okay. Okay. So, so what we tend to do, again, is we, all of us, our residents, we all stay in this static posture, okay? Back is flexed, neck is out like this, okay? We're not meant to live like this, okay? But we do. And what happens is that over time, you've got the wear and tear on your back, you're creating weakness around your abdominals. And I am such a proponent of just like, you've got to, if you're having back pain, if you're sitting and your resident is having back pain, you're having back pain, then you got to move. You can't just sit there and just kind of fight through it. It's like you got to move. Again, movement is medicine, okay? So one of my most favorite exercises is you just stand up and we just do a little stretch back like this, okay? So basically what you're doing is you're just reversing the effects. There you go. I see someone doing it. Yes, perfect. And guess what? It doesn't always feel great either. Okay, so if you haven't done it or your resident hasn't done it, okay, it's not going to feel good right away. But with continued work, doing this, okay, you will get range of motion. You will get a little bit more flexibility. I mean, and especially for, you know, all you care home, you know, providers and aides, people who are really having to, you know, work, you know, doing heavy lifting. I mean, yesterday I lifted a Max Assist patient from his, I transferred him from his bed to his wheelchair. And I mean, I was like this and I mean, I could feel it in my back. And guess what I did? Okay. Right away, once I got him in the chair, I just went back like this. Okay. Just a couple of times. I also just evaluated a patient yesterday too. You know, the patient that I was telling you about who has the shortness of breath and the COPD. He sits a lot. And, you know, when I was asking him about pain, he's like, oh yeah, I have pain. And when do you have pain? Oh, just when I'm sitting. Okay, well then you got to stand up. He's on a walker. And so what I did, he held onto his walker and we just did. And they're not going to have the mobility like this. Most seniors are not going to be like this. Unless they've practiced, like, you know, flexibility, you know, exercises throughout their life. But most of them are just, all you need to do is just go, okay, just lift your shoulders up, stick out your chest. Okay. And that can just be enough just to create that little bend curvature in the back to take some pressure off. And then, you know, and again, it's just really important to, like, you know, maintain that the abdominal strength and the core strength by doing, you know, bridging exercises, abdominal crunches. Good question. Any other questions?
Can you go ahead and send out your information from the name of your company, your name and number, only because there's really larger companies that we normally refer our residents to. So we'd like to go ahead and utilize your services.
Okay, how would you like me to do that?
If you can put it in the chat or have John put it in the chat.
Oh, okay. Like I said, I'm not very good at this. Okay, so here, I'm going to go here. Okay. So it's PT Works, LLC. Oopsie. Okay.
Sarah, would you like to share with everyone about the YMCA's programs? Those who are not able to see the chat, Sarah, our social worker, has shared that the Drum Alive program is available in Hawaii at the local YMCAs. And some of the Ys offer this class virtually if you want to use it in your care home. So just to know that this is a good opportunity that we have here in Hawaii.
So I'll say something. You know, I do love OC 16, channel 16 at 9 o'clock in the morning for the Kupuna hour. So they have stretching, Pilates, really low impact aerobics so that you can sit in the chair. I think that's really it's underutilized throughout the community. I think a lot more people should be watching that. It's even just, you know, our Kupuna love it. It's just fun to watch.
Oh, that's awesome. But just remember video exercises or TV exercises should not replace the interaction with the care home providers and the aides. So like I said before, you don't want to use it as a babysitter. Like you really want your staff in the care homes to watch the residents. And if someone's having like a harder time or they can't hear, making sure that the providers turn up the volume, or if they're having a harder time reaching, it's like, okay, uncle, let's I'm going to help you. I'm going to help you raise your arm up, or I'm going to help you with this. Okay. So that's my big pet peeve. It's to see like just video exercises that are, and people are just sitting there watching TV and not really interacting.
Someone had mentioned using the driveways and letting them do laps, but I think the idea is that they can get outside, right? Get outside and move around.
Yeah. So I was working I was at a care home, a really, really good care home out in Village. And I worked with this care home provider for a long time. And, she was great because, I had a resident that, he wanted to be able to go out and walk the cul-de-sac and, of the care home neighborhood. And, first thing I told the care home provider, I was like, okay, well, have them first walk out to the mailbox, because again, we only come in like 2 to 3 times a week. This again, then you have to really be effective. You want 30 minutes a day, 5 times a week. So, I told her, I said, just have him walk to the mailbox with you every morning to get the mail, or in the afternoon. And then she would take him to Long's as well, just to get him out and walking. And just, within that 2 months that I was working, with that patient, and she was following, my advice, like he was able to walk the cul-de-sac. He reached his goals, and that is it just feels so good when you can help someone reach their goals.
There's a question in the chat. Josie's asking, what's the liability if she wanted to do a class for a church group for elderly? Anyone know anything about liability?
I don't know, but I think a lot of times we're so scared, that we're like, something's going to happen. Well, but guess what? If you just keep a person immobile, guess what's going to happen? They're going to fall. They're going to become, overweight. Then they're going to have medical issues. So honestly, it's like, to me, that's more of a liability than trying exercise programs, with your residents to keep them active and healthy. And it's like, obviously you don't want to have a group exercise program. Everyone is in standing, and you're having them do these high level balance exercises, and, stuff that's like, that's going to be unsafe. But I think if you do, like, I think really think that we don't give our seniors enough credit. You know, we baby them. So I mean, I have residents do sit to stands who are on walkers. Sometimes it's just elevating a seat, getting them on a higher seat to do that sit to stand. So I think you just have to think of it that way, and you have to work with the physical therapist on good programs. In fact, I'm actually working with one of the big assisted living homes around here. We're actually revamping their entire group exercise programs and incorporating just more strength and balance exercises and circuits, like doing circuit training. So it's like one resident is, you have 4 or 5 exercises, and then you have 4 or 5 people in that, in the class, and they do circuits. So they go from one exercise to another, to another, to another. And that way, the staff can really watch, like, just that, the individual people doing those individual exercises. But good question, but don't be afraid. Really, really don't be afraid. In fact, I had a 92-year-old lady who had a fall a couple weeks ago. We did kettlebell swings yesterday with an 8-pound kettlebell. So,
oh, wow.
yes, and she was smiling ear to ear. She didn't do it perfectly, but you know what? She felt so accomplished by doing it.
That's great. Ruby, do you want to give an example? You had someone that had a hip fracture. I'll read it here.
Okay.
My one lady had a hip fracture, had surgery, and is almost back to normal, like it never happened, and she loves walking. So it sounds like she was getting out and moving, after her surgery when she could.
Absolutely.
Wow.
Yep. Again, I think we just have become so scared, and we don't, like, we're so worried about, what's going to happen, if they fall, or, but I think we need to push them just a little bit, through exercise. We can't baby, everybody. Good job.
I would like to share a case. This case is about my family member. So I had my mother visiting from India. My parents came for 6 months in 2022 after the pandemic. And my mother had 3 falls in Hawaii, 3. She had one in the bathtub. I was not at home. She pulled down the shower curtain. She pulled down the rod. She just slumped in the bathtub. That was one. A second one happened outside the bedroom. Nobody witnessed that. The third one, I was a witness. So we were coming out of church and getting to the car in the parking lot. And she did not see a little break or a little, the sidewalk was a little raised. Now, she has dementia. I've shared a lot about my mom and her Alzheimer's disease in my dementia talks. So what happens is I've learned from dementia trainers that people with dementia, their peripheral vision becomes less. Like Dorothy Colby would always say, look like a binoculars, because their vision becomes so little that my mother did not, though it was so obvious to all of us, the change in the church parking lot, she did not see it. So I always tell my mom, look down. Look down, look where you're walking. Now I saw you had a slide that says, look up. So my
Yes.
question is, are we to tell residents look up or look down?
Okay. So, yeah. So basically, yes. And I use this example all the time. Okay. because if you all do this, it's real. This is what, when you're moving more into like your moderate and advanced dementia, your peripheral vision is like this. Okay. However, if somebody is if you're walking like this, if you're doing this, okay, this shortens your gait. Okay. You start taking little tiny steps. Okay. Everything is just forward. And then what tends to happen is then the walker, they tend to push out their walker like this. It just becomes very, very inefficient. So yes, we want to promote like just that upright posture, because they also have to see what's ahead of them too. So, and in like assisted living homes, I mean, if she is like that, if her peripheral vision is that bad, like you need to be her eyes for her, when she is out and about. It would not be safe for her to be out and about on her own.
I agree. Can you hear me?
Uh-huh.
Oh, okay. Yeah, because if, they should be looking up, but like you mentioned, you have to be their eyes. So you have to be the one to say, hey, you're going to have to step down or step up, go right, go left. And the other thing I wanted to mention about the walker, I usually try to tell my residents to walk inside the walker, not behind it. Or then I remind them to stand up straight. I said, stand up straight. I don't want you to look old,
Yes.
But
Yeah.
the important part is they shouldn't be pushing the walker in front of them. They need to be, I said, walk inside that little square where your walker is, So that's kind of what I do to help them stand up straight
Yeah.
and
Yeah.
not hunched over.
Yeah. And it's kind of an out of control feeling too. Like when you see that their walker is so far ahead of them and they're flexed forward, like they actually mechanically, they just don't have like good balance reactions in that position, versus, okay, if I'm like this and I trip, okay, I'm already forward. Do you see?
Yes.
I'm already forward. But if I'm like this and I trip, then I'm able to use my balance recovery muscles better, more efficiently. Good comment. Thank you.
Okay. I wanted to share one of my residents. She's like 96. And one of us is always with her. But at some point in the bathroom with someone, it was a witness, like she kind of lost her balance and she ended up fracturing 4 ribs. But because we keep her active and we walk her around, we encouraged her to take her pain medication after she came home. I asked to bring her home rather than her going to a rehab center, because I felt like we could give her more care here. And she healed so quickly. We had her doing an sinus barometer so she wouldn't get pneumonia. But within like a week or 2, she was completely off the pain medication and back to walking her laps. So I think being active prior to any falls, because even if we're with them, they can still fall. But having that conditioning, really helped her post fall.
Right. And just remember that in that slide that, there is strong evidence to show that, seniors 60 and over, when active seniors, they have less medical issues. And those medical issues, it's the diabetes, the COPD, all those, it's just, they're healthier. And then one thing I also teach when I'm teaching like fall prevention classes is that there are studies that have showed like, we can't prevent all falls, but if a resident is strong, like if they have some muscle ball, do have some strength in those, in their legs, if they do have a fall, the incidence of like a traumatic fall, a death, is a lot lower.
one more question. Donna, do you want to ask the question or do you want me to read this? No, read it, please. Okay, no problem. So it says her client is 53 years old and is not mobile, but he's still able to use his upper body strength at times. He gets upset even though she has educated or let him know the importance of exercise or movement. Do you have any recommendations? Sounds like recommendations on how to motivate him. He does like 5 extensions with his arm and then he starts resisting.
Oh, well, that could be, you know, it would be, you've got to find out what motivates him. So is, walking to the mailbox. Can he walk to the mailbox? Can he go get mail? Can he help in the kitchen, during meal prep? Can he take, can he set the table? Help with like table prep, or cleaning dishes. So that's the kind of stuff that you have to like really, you have to talk to them and find out what motivates them. I mean, did he like baseball? Well, if he liked baseball, okay, go out and get like a little $5. They have like these little Velcro catcher, balls and catcher mitts, and it's just Velcro and it's like a tennis ball and you can, throw that back and forth. So you really can, you can adopt, exercise programs that are meaningful to a resident. It's just that you have to investigate and find out like what is meaningful and what are.
Can I share something? So I had a patient, he was like 5'11". He was a basketball player. Basketball player. And he played basketball Kinley, and just really when you know what their motivation is. So one of my substitute caregivers for Christmas bought him one of those little rims that attached to the door, and then his basketball, of course it wasn't a normal size, and we just had him throwing, and the next thing you know, he's trying to stand up so he can get closer to the rim, and I just thought that was so cute. But
yeah, yes,
and then
because he's motivated. That's awesome.
Yeah. So when it got too much for him to stand up because he was unsteady on his legs, we hung the basketball net on one of our tall dining chairs, the back part of it, and then we would, we'd have him shoot 50 baskets and then count how many he would get in, and he loved it.
Oh, that's so awesome.
You
Thank you for sharing that.
Thank you. Closed captioning. Who can?
Hey, John, I think we have to wrap it up for the day.
Okay.
Hey, John, I just wanted to make sure that you have, or I don't know who to ask, but I did share the all the different exercises that we discussed. I have pictures of all those exercises. Can the participants be able to have those, get those exercises?
Yeah, sure. Just send them to me and I'll put them on the website.
Oh, I'd already sent them.
Okay,
but I'll resend it.
I can look for them. Thank you.
Okay, did you want me to go ahead and read through this? Please share with our team. This is at the end of the evaluation. How many residents do you have total? How many of your residents feel unsteady when standing or walking? How many of your residents worry about falling? How many of your residents have fallen in the past year? These are things we should think about. And go ahead, and if you want to put it into your response into the chat box, that would be great. So it's 3 o'clock. I know there's some people logging off. So John, you want to go ahead and go over the certificates?
Yeah, just go go to the link in the chat box. I'll put it in again for all of you to see. It's linked to the evaluation. And if you want a certificate of attendance, this is very important. You click on that link. Make sure you click on the choice for certificate of attendance. It's a button towards the bottom. You click on that, and then you finish your evaluation, and then you should get it in the mail, your own email. If you are doing this for a group of people, you have to do the evaluation for each person. So you have to do it again and again with the person's name to get a certificate of attendance for them as well. Thank you.
Thank you,
for-
everybody.
Thank you.
I
Okay.
appreciate everybody attending today. Thank you so much, Dr. Rita Bell. I'm not sure if you're still on. Some people had to log off.